Double chin, fat or skin? A double chin isn't necessarily a matter of just having too much fat in the spot right behind the chin. The skin around the jawline has an important effect on making a double chin. The challenge in selecting the right procedure for a person is twofold. One, I have to get a sense of exactly what concerns that patient. Two, I have to figure out precisely what is causing the change that the patient doesn't like. By asking the right questions, I can ensure that if a patient decides to have me do a procedure for them, it'll provide the results they want. Often that person hasn't thought that much about the many different aspects of the lower face. There are several ways that fat and skin contribute to a double chin. Those are excess natural body fat, being overweight, having had weight loss, and skin changes related to aging. For people with a double chin caused by excess natural fullness, the rounded area behind the chin comes from a localized deposit of fat, which hides the desired angular facial shape. This can usually be corrected with simple liposuction, which allows shaping the area to make it flat. Liposuction is a simple, quick procedure that can be done in the office with local anesthesia and minimal recovery. Some people have a double chin caused by being overweight. Being overweight makes a double chin and a round face with overly full cheeks by causing fat to deposit in those areas. Even though the problem is still excess fat, the process of shaping the neck and jawline is different because fat is usually present over a more diffuse area. It extends from the double chin down along the neck and up over the jawline. Liposuction alone can usually be done for these patients, but has to be done precisely to produce an angular jawline and neckline. Even if someone who is overweight loses weight and the double chin becomes smaller, the shape of the area doesn't get much better. To create a more angular shape, liposuction can be helpful to create the desired contour at the jawline and on the neck itself. The other reasons for appearance of a double chin are related to changes in the skin itself. Weight loss patients might have loose skin that sits below their jaw, also appearing as a double chin but without excess fat. Loose skin is also caused by the normal aging process. That doesn't mean changes that occur in someone just because they're old. Time changes skin and the fat under it for everyone. Someone in their 40s or even 30s may have skin that's lost strength and sits lower on the face, which can appear as a double chin. Neck contouring for someone with loose skin from weight loss or aging is much different than it is for someone where the problem is from fat alone. The appearance of a double chin in this case is caused by loosening of the skin at the jawline. This can be seen with the passage of time. When cheek skin becomes loose, the first place it's seen is below the jawline because of gravity. Here you have a double chin that liposuction won't fix. People who have liposuction in this situation actually look worse because it makes the skin even looser. For someone with loose skin, it's usually necessary to tighten the skin on the neck. I prefer a mini lift or a neck lift using minimal incisions. It's a very predictable way to tighten the skin in the proper direction and by the correct amount to produce a certain shape. Non-invasive skin tightening methods either don't work or just change the skin in a limited area without improvement over the whole neck. The most challenging cases are those where the double chin is caused by a combination of excess fat and loose skin, which is actually pretty common. Here, a lifting procedure is needed to tighten the skin, and liposuction can be done at the same time to make the skin a uniform thickness behind the chin and over the jawline to create a nice angular shape. This is a simple procedure that can be done in the office under local anesthesia as well. Facial contouring involves much more than just liposuction of a double chin. It takes some detailed analysis to come up with the right approach to get a result that will make the patient happy.